As you all know, and as we've been discussing this morning, our urban Indian organizations are vital to serving the healthcare needs of our tribal communities across the country, and especially here in my home state of New Mexico. New Mexico is home to 23 sovereign tribes and pueblos and nearly 250,000 indigenous individuals, including over 40,000 living in my district alone, which largely includes the urban areas around Albuquerque. First Nations Community HealthSource in my district is a member of the National Council of Urban Indian Health and is the sole urban Indian health center in the state of New Mexico. First Nations offers healthcare, including primary care, dental, and behavioral health services to eligible individuals at no cost in the Albuquerque area. And I want to take a moment to shout out and lift up their incredible work and that of our frontline healthcare workers who have been working day in and day out over the last several months as we've been facing this difficult pandemic. This is why I am so proud to co-sponsor and urge passage of HR 5221 to require our Health and Human Services Department to confer with urban Indian organizations before major decisions are made. HR 5221 will ensure that HHS keeps adequate lines of communication open with urban Indian organizations to ensure that healthcare needs of our communities can be met. The lack of a standing Confer policy from the Department of Health and Human Services and its delay in vaccine rollout for urban Native communities is absolutely unacceptable. Healthcare is a human right, and the federal government has a trust, treaty, and moral obligations to ensure our tribal communities have access to care. In this instance, the federal government neglected to fulfill its obligations, and it's critical that we address and institutionalize these policies going forward. First Nations and all urban Indian organizations have worked tirelessly throughout the pandemic to serve our communities and would greatly benefit from this legislation. The health and well-being of our tribal communities has been neglected for far too long, and it is our responsibility to ensure that we are meeting the needs of our communities. So I look forward to working with my fellow New Mexican Chairwoman Representative Leger Fernandez and with Chairman Grijalva, and thank him for bringing this legislation forward. And I'd like to ask a question briefly of Deputy Director Smith. And thank you, Mr. Smith, for being here with us today. And thank you also for serving. It's a difficult job. As we all know, this pandemic has brought so much loss and hardship to our communities. Here in New Mexico, our tribes and our pueblos have been leaders in vaccination efforts, and in many cases have 90+% vaccination rates. But here in Albuquerque, in my home district, we have a number of instances in which individuals were delayed in being able to access vaccines through the Indian Health Service and clinics. So I know we've talked a lot about it this morning, but could you please take a moment to help us really understand why there was this delay in vaccine rollout to the UIOs, and what specific steps, besides some of the policies that you've described already, HHS is taking to make sure that this does not happen again?
Thank you, Representative Stansbury, for the comments and questions. Certainly, we believe that this is a all-of-government approach, including our state partners, as well as local government officials as well. Identifying the problems is always key. I think addressing the issues through our incident command system structure really helped bring to light some of the challenges that were being faced throughout the country locally. You know, as I mentioned earlier, right now, the requirement to confer with urban Indian organizations is only extended to the Indian Health Service. So what this means is other divisions across government relied on Indian Health Service to initiate urban confer efforts. With the policy, we sought input as quickly as possible and tried to develop the needed gaps for information. We were able to work through some of the supply issues. But to your specific question about New Mexico, I will have to take that back to the agency and do a little bit additional research on that. but would appreciate to follow up with you.
Thank you, Mr. Smith. I really appreciate that and look forward to the follow-up. And again, thank you for serving and very much look forward to seeing this legislation pass and ensuring that we institutionalize this confer policy, not just at IHS, but throughout HHS and through other federal agencies that may be working with clinics and nonprofit organizations serving these populations. So very much appreciated. Thank you.